Hi, guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources and tools, review courses, videos, review books, and other material to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, you guys, helping nurses and nurse practitioners internationally with exam success. If it's in school or for boards, we have been working throughout the years with a 99% pass rate on our comprehensive review and a 100% pass rate on our one-on-one sessions. But y'all know I like to get into my disclaimer before getting into any other questions. Just a reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis. And I know that it differs for things that we do in practice versus things that we are doing for boards. Any of the questions that I provide are designed by myself based on the guidelines that they are testing on currently for the ANCC as well as AANP exam. I do this to try to give you an idea. Test your knowledge, but also show you in a fashion on how to apply it based on what they are currently testing so you can be prepared, okay? And if I'm doing videos and I'm telling you or teaching you on things that we currently do in practice, I will say that in the video so there's no confusion, okay? All right, you guys, with that being said, let's get into question number 1 for today. Question number 1 states, the nurse practitioner and NP student are discussing the common uses of SSRIs. All of the following are common uses of SSRIs except, is it A, depression, B, OCD, C, delirium, or D, PTSD? Take a moment and tell me what you got in the comments, you guys. All right, you guys, I always recommend reading the stem of the question first. Stem of the question being the actual question that typically at the very end of the scenario of the paragraph, right? Because this allows you to slow down and truly see what they're asking you so you can ensure you're even answering what's being asked. You know, Commonly on the exams, these scenarios are pretty lengthy. They're fully detailed paragraphs. And sometimes the stuff that's in those scenarios is not what they're looking for in the question. It's just background information, fluff, just extra material. And you start to form your own storyline. And then when you get down to the end and realize, listen, it's not even what they're asking me about, right? And so that's why I say, hey, just take a moment, look at the stem, and start to process what this is even about, okay? All right, so here the stem of the question states all of the following are common uses of SSRIs except. So, all right, pay attention to those terms like except, not, those outliers so that you know to eliminate because we're looking for the one that's incorrect, right? Again, this is classic. Look at this so you're not just instantly reading the question fast and saying, "Oh, okay, let me see what the use is for SSRI," and boom, I know depression is, and you select the wrong answer. No, they asked you all of the following are common uses of SSRIs except. So you're looking for the one that is incorrect. So A, depression, we know we use that SSRIs for that, right? So we can eliminate A. B, OCD, obsessive compulsive disorder. Yes, SSRIs are also used for that. C, delirium. No, you can eliminate C. D, PTSD. Yes, SSRIs are also utilized for that. So your best answer here is C, delirium. SSRIs are commonly utilized, we know, for depression. Sometimes it can be utilized for anxiety. It is utilized for OCD. It is utilized for PTSD. Also can be used for utilized for bulimia. So just be familiar with it. And I'm going to do more on meds because I get a lot of questions from you guys. And a lot of times when I'm doing my one-on-one sessions, this is y'all's biggest concern. So you'll see me incorporating more of these. I know you've seen some farm things, but we'll do some more. Okay. All right, question number 2. A patient presents to the office with complaints of sore throat and fatigue. Upon examination, the nurse practitioner notes that the patient has noted posterior lymphadenopathy. Vitals are blood pressure 120/74, pulse is 76 beats per minute, respirations are 20, and the temperature is 101. Based on these findings, what diagnostic exam should the nurse practitioner complete to confirm the diagnosis? Is it A, rapid strep test, B, influenza test, C, monospot, or D, a COVID test? Look, I put C too many times, huh? Tell me what you got in the comments, you guys. All right. So, stem of the question states, based on these findings, what diagnostic exam should the nurse practitioner complete to confirm the diagnosis? So, all right, you know what I tell you. If it's asking things about the diagnosis, diagnostics, you need to run it back and see what the assessment findings are. In this situation, it is asking which diagnostic exam. All right, so sidebar, you know, I tell y'all to think assessment, diagnosis, evaluation, treatment, right? And I tell you, in that the diagnosis section of this, you need to know like the differential diagnoses. You want to know your gold standard diagnostic exams. All of that can fall under this window, right? So, assessment findings are going to help lead you to this because your assessment, what the patient is saying is going on, what you're observing is going on, your vitals, the things that you have conducted in your assessment is going to start to lead to your differentials, which makes you want to do your gold standard diagnostic exams, right? To confirm your thoughts. So this patient came in, they're complaining of sore throat and fatigue. Instantly, your mind should start leading you to the things that present with sore throat, mono, strep, tonsillitis, some sinusitis, that's not the common thing, but they can have some of this, just thinking of all of the stuff, various things people can have sore throat associated with it, right? A lot of the respiratory things you can potentially have it. So you're like, all right, let me just see a little bit more. Um, so then the nurse practitioner has doing their exam, their assessment. There's noted posterior lymphadenopathy. The vital signs, blood pressure is all right. Heart rate's all right. Respiration's all right. Temp is elevated. So they are febrile. They have a fever, right? So now we have a sore throat, fatigue, posterior lymphadenopathy, and fever. So in your mind, you should start to think mono, right? Mononucleosis should be up there at the top. You probably could have put it there, mono and strep. But Brittany's brilliance. I always tell you guys, think about this. Mono has posterior lymphadenopathy, where strep has anterior cervical lymphadenopathy. Okay. So this should have you thinking mono, and then you need to think, all right, what is the gold standard diagnostic exam for mono? And it is C, monospot, right? All right. Now, question number 3, last one for today. The previous patient tested positive for mononucleosis. What is the virus? What is the virus that is the cause of mono? Is it A, the parvovirus, B, the Coxsackie virus, C, the Epstein-Barr virus, or D, strep? Take a moment and tell me what you got, you guys. All right. So, stem of the question should state, which virus is the cause of mono? And again, this is one of those knowledge-based um, questions, but the virus associated with mono is C, the Epstein-Barr virus, okay? C, the Epstein-Barr virus. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure y'all meet me back here. If you need any of the resources that I offer with the Nursing Studio, just give us a call at 803 400 6864. You can also text that number or shoot an email to the nursing studio 1@gmail.com. Things that I offer are my review book, which is offered in an ebook option, also offered in a paperback option that is mailed to you. There is a video in the shorts that where I flip through the book so you can have an idea of what it looks like. But those are both linked in the bio of this channel. As always, I'll talk about it. But the ebook, of course, once you purchase, it's instantly accessible on any of your devices. It's broken down by system. It has interactive session. It is color coded with images, especially in the derm section. I'm big on charts, so you'll see the images broken down with their description, their name, and an image, and treatment. So just like in the style that I teach y'all to study in, that's the way it's laid out. It is short and sweet fashion, so you can review on the go. um, so if that's something you need, that is available. Also, there's a self-paced exam that is for independent study, broken down in the same fashion with a downloadable PowerPoint associated with it. It's broken down by systems. It is for family and adult Gero, and designed for the AAMP as well as ANCC. There is a non-clinical session section on there. There's many quizzes with each, and you can watch the videos repeatedly. It's broken down into small videos in each system to help it to reduce that like overwhelming faction, that overload of information. And I'm teaching in those, and that is also linked in the bio of this channel. And then our 5 week, our next one, which is a group course, it starts June the 10th. So that link is also here in the description. And then lastly, our one-on-one sessions, these are customized and designed based on your study timeline and needs. So I always say, just give us a call, or shoot us an email so we can determine what your needs are at that time, okay? And it is priced based off of the sessions and the timeline of study. So there is a range, but that's why I said it's easier just to call or shoot an email to discuss those. But as always, y'all make sure y'all meet me back here. If you have any questions, want me to cover certain things, be sure to put it in the comments. I am happy to do so. But as always, happy studying. Bye, y'all.